So good afternoon everyone. This is the presentation about emergency 24/7. This is a social utility app, a kind of app which all of us can use at different points of time. And this app was sponsored by Apollo Hospital, one of the largest hospitals in the country. So what is the object of this app? One of the object of this app is that as individuals, if you travel to another city and all of a sudden you have a medical situation where you're looking for a doctor or a surgeon or a physician or a pharmacy, how do you find something? Second is that, once upon a time we all used to live in our places for a number of years, 10, 20, 30 years. So we knew the doctors and the entire ecosystem around us. Nowadays all of us are so mobile, changing homes, living in smaller groups. If somebody asks you where is the next dentist, you have to start picking up the phone and finding out where's the next place to go to. Or if you are in an office and suddenly somebody falls sick, you really won't know where is the nearest hospital. So the object of this app is to create that kind of a support and infrastructure that if you have an emergency, this app can immediately come in handy and help you resolve the emergency. So the kind of people we targeted were nuclear families, people who are traveling all the time, and people who are not familiar with their neighborhood or locality. So what does this app really do? So moment you have a family emergency or some kind of a medical emergency, the app is residing right on your top tray. If you're using an Android, right at the top itself the app is residing, and at a click of a button, this particular app will send out SMSs to people who are predetermined by you, saying that these are my 3-4 friends, or my wife or my father or my brother needs to get a message. It will pick up your GPS location immediately wherever you are and send like a predefined message. So at a click of a button, you are able to reach out to people you need to reach out. B, if you are looking for information, again at a click of a button, it will help you find whichever is your nearest hospital or location next to you. We have a small video. Let me just show you the video to help you understand the app. Siren, if you press the button, it will start emitting a siren. This is a service locator, uses Google Maps to start pulling out information and giving you. When you click on a button, you can call out the hospital you are looking for. Rescue services 100 108, you can call us at number. Advanced services. You can create your own phone book, so you can store locations close to you if required. For emergency and help guides, how to help somebody with first aid. App has received very good reviews, as you can see. About a month back, I think now we've reached about 25,000 downloads by now. And the app has won plenty of awards at other events for the kind of work it is able to help give services to people. So these are some of the screens, for example, you can add guardians on the app. So people who are added as guardians, these are the guys, once you click a button, will immediately get an SMS with a message saying that I require help, and also give you your GPS information. There's a button to call rescue services, so numbers are pre-fed in, whether 100 blood bank service, heart special service, so you can just pick up those numbers. List of hospitals, again picked up from Google Maps, gives you a complete list of hospitals in your neighborhood, in your vicinity. There is access to guides. So suppose you're suffering some kind of heart attack or something, what should be the first aid to be given? There are built-in guides, like a first aid till the doctor arrives. There is something called managing favorites. So you can actually store locations in your neighborhood, your house or office, wherever you are working. So you can immediately reach there if you require any information. There is a siren that rings out in case of an emergency. You click a siren, it will make a noise, so people know you have some kind of help that you require. So finding doctors, you can call hospital. So all the database of hospital is fed in this app. Besides hospital, you can find pharmacies or dentists or all those kind of services. The entire healthcare fraternity is kind of mapped into this app. You can see directions on the app, and this is like a widget which resides in your tray. So you don't need to switch on the app. The moment your Android phone switches on, this app will remain always on. In an emergency, you don't have time to search for an app, click a button, wait for the app to start. The app is always on your Android phone tray. With a click of a button, you can start accessing information. And this is the kind of menu you can see, So show me hospitals, doctors, dentist, pharmacy, physiotherapist, veterinary. Select whatever you try to show, whatever is nearest to you, based on your GPS location. Testimonials that we have got for the app, people have been using the app, extremely helpful, very useful, amazing, nice app. App has also been reviewed by other websites. We have done a lot of reviews on the app to talk about the app and the quality of app and the work that is happening. Again, some more reviews on some other websites. As I said, won lots of awards. The app has won award at the IDMA, IAC, as well as recently won award in Philippines, by the worldwide medical fraternity for the app. So that's it. I took hardly 6 minutes.
Yes.
So if there are any questions, I can take them or maybe later.
What we'll do is, if you all have any questions, because I think you all have to go for some next presentation. Yeah, so we can have, you all can question them, then we start with the other one. What time is your next? In how many minutes?
It's actually running in parallel.
Okay. So anybody for questions?
Yeah.
Does this store be about the surrounded areas offline?
Offline means?
Like if I'm at home and I don't have internet at that moment, if I'm in the emergency.
Yeah. No. It will be able to access your location, and it needs to access Google Maps.
Location using GPS is fine, right?
It also needs to access Google Maps. So if it can't access Google Maps, it can't give you information. Good question.
So in your presentation, you haven't mentioned about the statistics of use.
Yeah.
So would you like to put light on that? How many people have used it, and did you get some feedback on that?
Yeah, absolutely. So I think in the presentation, as we mentioned, I think till about 1.5 months back, we had 12,000 downloads. In the last 1.5 months, we've seen about 25,000 downloads. On a monthly basis, we are getting about 2 lakh page views. So people using the app have accessed Google Maps almost like 2 lakh times, like in a month we have seen. And you can see a lot of customer reviews. I showed a lot of reviews of customers who actually use the app. Plus the app has been rated on the Android store. So you can see the rating of the app on the Android store also. I think we are rated around 4.3 or 4.5. Yeah, that's the kind of rating on the Android store.
So do you use profilation in when customizing the application, or is it all generalized one? What I mean to say is that, suppose if you want to target some people, say VIP people, and those are having the chances of some particular diseases, and you can guess it early, because your application comes in picture when the person gets some severe kind of things.
In case of an emergency.
So how better it would be if the application can, with the help of some sensors are there which are coming nowadays, can sense those things which are going abnormal. For example, the blood pressure or the sugar level, or some other symptoms, and then automatically they can unknowingly to the person who is suffering from that, it would go to the medical caretaker. So that will be great, because if the person comes to know that I am getting some problems, otherwise he will be getting some psychological issues of that.
Sure. So this app doesn't serve the purpose. This app doesn't help you to self-diagnose what is happening. None of those things. We believe there are lots of apps in the market that do it. You know, you put your finger, it'll give you the blood pressure and all these kind of things. This is basically an emergency service locator. You know, so we made the app with a very specific mission. When you make any kind of an app or a community or something, your goal has to be very clear. Moment you try to do lots of things, you get completely lost. So we were very clear that in the market there is a requirement for emergency help when I require help. This app only takes care of that. It doesn't do any self-diagnosis.
So the medical service providers are known or unknown?
All known, basically being picked up from Google Maps. So if you have been listed on Google Maps, it will show up here.
Okay.
I have a question here. When you're picking up from Google Maps, does it show that every hospital has what facilities? Like suppose somebody is having chest pain. I mean, that's the biggest emergency or a stroke coming up. So when you have too many names, so do you have something okay for all these emergencies? These are the nearest hospitals.
So I think when a hospital or a location is creating itself on Google Maps, there is room for it to write 1 or 2 lines of information. To that extent, you will get it. It doesn't give you like department-wise listing. You know, because we wanted to cover the whole country, we really couldn't go and map each and every hospital and pick up data. We tried to use the Google Map built-in layer, and whatever information shows, it will show you there. Yeah.
If it is an emergency service application, then how do you ensure a response?
The response is not supposed to come from somebody else. It is supposed to help me. Okay, so what does it do, for example?
But then if I call, there are some names listed in that app, and if I call that agency or hospital or clinic,
So
whatever.
these are not proprietary names. Okay, these are basically names in the public domain. So for example, there is a 1808 number if you require a ambulance for heart, for example. You know, it is picking up the information from
But
public
then
domain.
those numbers are very much there if I just note it under in case of emergency kind of a thing.
The problem
Those
is most of
numbers
us
are
don't
very
do
much
it.
there.
Problem is most of us don't do it. Right? How many of us in this room have actually noted emergency number on a cell phone? Okay, this gives you information at a click of a button. Plus, if you are
Yeah,
traveling
but then
between-
those who would think of this
Sure.
can also think about
maybe they can.
much
maybe
easier.
They can. Maybe they can. Maybe they can. Maybe they can.
Okay, and of course the elderly and those who are not techno savvy,
Yeah.
they are unlikely to be helped by
Oh,
this.
absolutely. So we expect people around them who are the caregivers to actually use the app.
Okay.
there was one thing you said is on the spot rescue. Like you all had something that. I'll just, because we are doctors,
Sure.
so and I'm sure I mean it's really nice, and I really like the whole concept of it.
Sure.
What I want to be very clear about is suppose I'm having chest pain.
Yeah.
Okay, and even if we locate some hospital, and even by the time they you mentioned something that there is a way where they will tell the people around how to resuscitate or
So there are some built-in help guides.
which is there. You mentioned.
About 10 guides have been built, which are built-in guides
Okay.
looking at common problems.
Okay.
So say for example, if somebody has a stroke, what is the
Yeah.
first aid to be given?
Okay.
If somebody has a fit, what is the first aid to be given?
Okay.
So there are some built-in guides, about 10 of them have been built so far.
Okay.
As the app becomes more successful, we want to build more of those guides. You know, because by the time I reach hospital,
Yeah.
what to do for that
What
1
to
hour,
do
half an
there.
hour.
Yeah.
And most of us don't know.
Yes.
Theoretically, we know everything. But exactly what to do, we don't know. So about 10 such guides have already been built in the app.
So that is through words, or is it like
Illustration. It's only illustration. It's like line diagram illustration,
Okay.
which will tell you. You know, by looking at the diagram, you can figure out what is happening.
Okay, that's.
The last question, is it free or it charges something?
It is free. It's a social utility. The concept of a social utility is free. Okay, the money is paid by the hospital. So our whole message to the hospital was, as a hospital, your job is to help patients. So besides helping patients who come to your hospital, how can you help everybody else? So it's like a social utility that the hospital has created for everybody. It's a completely free app.
Okay, good initiative. All the best.
Thank you.
By the way, how many lives are saved till now? I mean, from the time you. I mean, did
We
you all,
don't-
do you
we
all
don't
get
have.
feedbacks?
No.
Firstly.
So we have feedback of people who have come and said the app is nice, but nobody has come back and said so far life has been saved.
Or
And
life
nothing-
was, like it was. I think you all should work a little bit.
Maybe
in
we
that,
should have to find out.
That
if,
way,
you know,
yeah.
that'll help.
I mean, since
That's
it's such
good
a
suggestion.
beautiful initiative,
Sure.
people who have used the application for emergencies.
I understand.
real
And if you can
emergencies, like
showcase that, that is really nice. You know, it
showcase
can
well, and you
demonstrate.
also will feel good that
Sure.
okay, yeah,
Sure.
Thank you.
Thanks.
Any other questions for them, from the audience?
So do I have your permission to move to
Yes,
the next room?
thank you
Okay,
so much.
Thanks.